Hi there, welcome to our Medicare Basics 101. We have Zach Remington, my husband, myself, Karen Remington, and this is our client, Jean, who has joined us today to review all of the information that we can provide to you regarding Medicare.
So yeah, thanks again for joining us. I'm really glad you're able to come out and learn about the different parts of Medicare. We're going to go over all of the parts of Medicare and give you about a 20-minute presentation, and so that you can have some real basic understanding of how Medicare works.
Yeah, and Jean, tell us a little bit about maybe why you joined us today.
Well, I'm really happy that you invited me in to see this session because Medicare is so confusing. I mean, there's part A and B and D, and then you go back to C. It's just an alphabet of information, and I have to get it straightened out by the time I'm 65.
Certainly, because it seems like you're just starting to get all of that information now in the mail.
Yes, I'm receiving information in the mail, and I'm getting phone calls, and it's making me a little bit nervous.
I would imagine a lot of phone calls and a lot of mail.
Yes.
Okay.
Well, a little bit about us. Karen and I have been working with folks on the different Medicare plans for the past 20 years. We have a really good understanding of how Medicare works, the different parts, and how you can get coverage that'll help fit your needs.
Thanks, Zach. Yeah, Zach and I have been doing this together, as he said, for about 20 years. And our situation is that we like to work for you, not the insurance companies. We want to make sure that we find the best plan that fits your needs. And today we're going to review what Medicare is and is not, and just help you to become informed about what's available.
So yeah, here's our route for today. Step one is we're really going to choose a destination. Think about where we want to go with our health care. Then we'll go right into step two, getting ready to understand Medicare eligibility and the different enrollment periods. And then we'll get into step three, discovering and learning about Medicare and the plan options that are available. And then finally, we're going to arrive at step four, where we can be able to choose a plan for ourselves that really best fits our needs.
Explore confidently with Remington Insurance. Local market expertise, personalized guidance, and choice and flexibility.
Yeah, Karen and I both have expertise in the local market here in Maine, New Hampshire, and Vermont.
And we work with all of the major companies so that we can provide you with options, and you with options, Jane.
Thank you. I appreciate that.
So yeah, step one, thinking about where we want to go. We want to really have a good understanding and overall well-being of how a plan works for our specific needs. I'm really looking at predictable healthcare costs and how they work, and coverage for all aspects of our health, including dental, vision, and really having the confidence and the peace of mind of knowing that the plan we choose really does fit the best of our needs.
And Jean, do you have any specific questions that you would like us to review during this time together?
Well, I'm looking forward to the information that you have available and helping me make sense of the different plans that I'm receiving now.
Okay, sounds good. Many of our clients have lots of questions. Those questions are regarding prescription coverage, provider network, benefits like dentist, vision, and over-the-counter items, out-of-pocket costs like co-pays and deductions for covered medical services, and coverage for out-of-state.
That's a great list. I'm looking forward to you going over it.
Well, get ready, because we're taking step two, and we're really going to look at understanding Medicare and the different eligibility and enrollment period. So really understanding Medicare is really understanding how and when you first become eligible for Medicare. You become eligible for Medicare when you turn 65 or under 65 with certain disabilities, or at any age if you have end-stage renal disease or kidney failure.
Or if you're a permanent U.S. resident or a legal citizen living in the U.S. for 5 years in a row.
Well, another qualification is you need to have worked and paid into Social Security for 10 plus years.
The enrollment period. So the initial enrollment period is also known as IEP. This is a 7-month period that this is the time frame that you can actually go into Medicare and choose your plan. So this is when you'd be going on to Medicare A and possibly B. Sometimes people elect not to go right into B if they're still working. And once you do go into Part B, that is then your initial election period. This is 7 months, counting 3 months before you turn 65, the month of your 65th birthday, and 3 months after you turn 65.
And don't forget, there's also a general enrollment period that if you forget when you first become eligible, that you can join Medicare. And that's from January to March 31st. And then your coverage would start on July 1st. However, once you become eligible for Medicare, there are different election periods where you're able to change your plans that you've already joined. That's called the annual election period, and that starts every October 15th through December 7th for your coverage to begin on January 1st of the following year.
There's also a special enrollment period if you move during the time and you move out of your plan's network. There's also if you are dually eligible, if you have Medicaid, state assistance, and Medicare. This also puts you into a criteria, a special election period, if you decide that you would like a plan that maybe has stronger benefits or the plan that you're currently on is just not serving your needs.
So let's look and learn about Medicare and your plan options. Original Medicare starts with Medicare Part A, which is all about your hospitals, skilled nursing facility care, hospice care, and some home health care.
And then we have Medical Part B. Medical Part B covers doctor services, outpatient medical, surgical services and supplies, clinical lab tests, durable medical equipment, and preventative services.
Does that all make sense so far?
Yes, thank you.
Great. So, original Medicare was never really intended to cover everything. And some healthcare costs aren't even covered at all, like prescription drug coverage is not covered under original Medicare. Dental is not covered under original Medicare. Vision, hearing, and extended long-term care.
Jean, were any of these areas something that you needed extra help with?
Oh, certainly, especially the prescription drugs and also hearing aids and of course dental. So I'm very interested in these plans.
Oh, good. Okay. So that actually speaks more to the Medicare Advantage, where the Medicare Advantage plan will offer more of those benefits these days.
That would be good.
Yeah.
So yeah, there are some choices for protection against the high healthcare costs. You have choices like a Medicare supplement plan, or adding to that Medicare supplement plan, adding a prescription drug plan, otherwise known as Medicare Part D, or you could choose a Medicare Advantage plan. So there are choices.
And then Medicare supplement plans help to fill the gap, also known as Medigap plans. Medigap plans help pay for original Medicare, what original Medicare costs don't cover. Deductibles, co-pays, and co-insurance. Purchased through insurance companies, a range of plans with varying premiums and coverage may require underwriting. The underwriting, though, just to talk about that for a moment, the underwriting only happens if it's not during your initial election period. Once you are turning 65, you don't need to worry about underwriting. There's no...
It's a guaranteed issue.
Thank you. It's a guaranteed issue. I was going to say there's no pre-existing conditions that you need to worry about.
Well, that's true too. There's no pre-existing conditions or waiting periods.
Exactly.
Yeah.
That's if you, for that first time that you enroll into a Medicare supplement, there's no worries about that.
So then you can add to your Medicare supplement plan a Medicare Part D prescription drug plan. There's optional plans from different insurance companies like United Healthcare, Blue Cross Blue Shield, just to name a few. Different plans have different formularies, so it's important to make sure that the plan that you're choosing has the prescriptions covered under that plan. You pay a monthly premium as well as deductibles and copays often, and you may have to pay a penalty if you don't enroll when you first become eligible. Like when you first become eligible for Medicare, if you don't enroll, you could pay a penalty. So that it's important to know what your choices are.
And when to choose them.
Jean, you mentioned that you're currently not taking any prescriptions.
Well, not right now, but I'm concerned as, of course, I enter retirement that prescription drugs will be something that creeps up as an expense.
Certainly. I know some people who opted not to purchase a Medicare Part D plan, not realizing that there was going to be a penalty that accrues at a 0.03% monthly every year. And that never goes away. Once you have that penalty, you're kind of stuck with it.
That penalty is pretty scary.
Yeah.
It is, and it's important for us to really look at these Part D plans and see really how they work. There's stages to all of the Medicare Part D plans. CMS, the Centers for Medicare and Medicaid Services, said that all of these plans can be offered by private insurance companies, but they have to follow this one model. And the model is step one, you have a deductible, and that varies by the plan that you choose. You pay the cost up until the deductible, if there is one, and then you fall into the initial coverage phase, which is phase two. It starts after you pay your deductible, if there is one, and your plan pays 75% of the cost, and then you have copays up until $4,130 of total drug costs. After you and the insurance pays $4,130 of drug costs, you fall into what they call the coverage gap, or donut hole, some people refer to it as. And that starts after you pay the $4,130. And it ends after you spend $6,550 of total drug costs. And then while you're in that coverage gap, you pay 25% of the cost for your brand name drugs and your generic drugs. And then after that, after you pay the $6,550, you pay the greater of, the plan pays 95% and you pay 5%. That's how all the Part D prescription plans work.
Now, it's my understanding, Zach, that the donut hole or the coverage gap has actually been shrinking over the last few years, that the government is trying to help seniors a little bit more with this coverage gap.
Yeah.
And kind of shrink the hole a little.
And it has. It's closed now at this point, but the cost is you pay 25% of the cost for your brand names and your generics.
So Medicare Advantage, the all-in-one solution, also known as Medicare Part C. Provided by insurance companies that contract annually with Medicare, include all the benefits of original Medicare, prescription drug coverage, and more. Helps keep the premium low with no extra cost for Part D and no Medicare supplement premiums. One company to call for coverage questions and customer service. Original Medicare is Medicare plus Part D and a Medicare supplement, where most Medicare Advantage plans cover prescription drugs. You may be able to add drug coverage in some plan types if not already included, and only has one ID card that you need to worry about showing when you go to the doctors, to the pharmacy, or to the hospital. Two basic types of Medicare Advantage plans are the HMO and PPO. Jean, are you familiar with these plans?
Well, I feel like I've been in an HMO plan with my employer, but I don't understand the PPO plan and the differences between. So if you could help explain that, that would be great.
Certainly. So with an HMO, you know that you're familiar with that you need to stay within the network and you need to go to the doctors that are in the network. And they also give you referrals to specialists in the network. And if you go out of the network, you're not covered. Correct?
Yeah. That seems to be the case.
Certainly. And sometimes people feel great about that they're comfortable with their doctors and they don't need to go anywhere else, and that's great. However, for someone who wants more freedom, or they don't want to have to be confined to just their network, and maybe their doctor's not in the network of the plan, then we look at the PPO, which provides more freedom for you, and you get care in or out of network, and you're still going to be covered. You may have a higher premium or higher co-pays, but you're still going to have coverage.
That sounds great.
Good.
So yeah, you see, Jean, there's more benefits to protect you and your health and your finances. There's a lot of options that are available with these Medicare Advantage plans, and we'll go over those now. Some of the extra options that you can have will be dental benefits, vision benefits, hearing benefits, visits with licensed therapists through Live Healthcare Online.
Silver sneakers. The silver sneakers, fitness. There's also Renew Active with United Healthcare. And if you don't want to go out to a gym during COVID, for example, then having information sent to you. They have like those fitness trackers, and they'll just send a home gym kit right to you. There's also an over-the-counter catalog where you can call for supplies, where you get credit every 3 months on a little card, and you get to go shopping on a catalog and have stuff sent right to you. Some companies have it so you can go right to the store, and none of this costs you any extra money. It's just a service that they provide. The goal is that these companies actually want you to stay as healthy as possible. So they're really supporting you in every aspect of your life that you can have any issues in. Vision, hearing, dental, over-the-counter items, and getting strong with fitness.
So yeah, they're here to help you save money, basically. There's 0 to low co-pays for your prescriptions and a spending amount for the over-the-counter items like Karen mentioned. So we're really kind of arriving at step 4, being able to choose a plan that's really right for us. So we do have some choices. We can choose from original Medicare and adding the Medicare supplement plan and the prescription drug plan, or we can choose a Medicare Advantage plan where it includes everything. Our doctors, our hospital, and our prescription all in one.
And I can tell you, in my experience, individuals more often go with the Medicare Advantage to save more money. But if their health is declining, then they're going to turn around and look at the Medicare supplement. It is important to review these plans every year so that you can choose between a Medicare Advantage or a Medicare supplement and make sure that you're getting the plan that best fits your needs.
And how does that happen? Do I call you?
Absolutely. We are available to come to you, or you can come to our home. We can also work over the phone, online. These days, it's very versatile how we can work together. But we'd be happy to be your agents and to assist you for as long as you would like.
Thank you.
Thank you for coming today. It's been very helpful.
Yeah, thank you so much, Jean.
Very informative. I really appreciate it.
Well, thank you everybody for coming.
Our information is up on the screen, as you can see. So please, if you would like to give us a call, I am Karen. This is my husband, Zach. We thank Jean for being here with us today, and we look forward to hearing from you.